Hypertension is when blood pressure is higher than normal. Although symptoms are typically not noticeable, hypertension is responsible for many medical problems such as heart attack, stroke, kidney disease, and ultimately death. This is why high blood pressure has been described as the silent killer. Hypertension is a condition that affects up to 30% of all adults and up to 50% of adults greater than age 65. Primary hypertension accounts for 90% of high blood pressure cases, and although there is no identifiable cause, the known risk factors include high salt diets, high alcohol intake, family history of high blood pressure, obesity, age, and race. Hypertension is defined as a blood pressure greater than 140/90. If you are diagnosed with high blood pressure, you need to be evaluated by a physician for care. You can be evaluated by your primary care physician, and if your blood pressure is not controlled, an evaluation by a nephrologist is appropriate. The nephrologists at South Texas Renal Care Group are hypertension specialists, and we will help you determine the cause and formulate a plan on how to manage your blood pressure to reduce any complications. The plan typically has more than one aspect, including education on how you can reduce blood pressure on your own, such as weight loss, diet, decreasing salt intake, exercise, and a medication aspect that is tailored for you. Many people also benefit from home blood pressure monitoring. Hypertension is known to be a risk factor for the development of kidney disease. It is important to determine the type of kidney disease that you have, as this will determine the preferred treatment. For example, if you have evidence of excess fluid or swelling, then you will likely benefit from a diuretic or water pill. If you have protein evident in your urine, you may benefit from a medicine used to control blood pressure known as ARB or ACE inhibitors. Therefore, it is important that you get a full evaluation for the best directed care. At South Texas Renal Care Group, we want to help you stay as healthy as possible. With regular visits, we will watch your blood pressure closely and monitor for any complications, including kidney disease.
There are two types of hypertension: essential, which is when the cause is not understood, and secondary, which means it is reversible in most of the cases. Treatment of hypertension is the most common reason of office visits of adults to clinicians in the United States of America. The National Health and Nutritional Examination Survey estimated that 29 to 31% of adults in the U.S. have hypertension. This means that 76.4 million Americans over the age of 20 years have this disease, and only 50.1% are under control. Hypertension will remain as the most common risk for heart attacks and stroke in U.S. The causes of hypertension include over-the-counter medication like decongestion, illicit drugs such as methamphetamine and cocaine, primary renal disease, which can be acute or chronic, particularly with glomerular or vascular disorders. Renovascular hypertension, which is the affection of the kidney blood vessels due to fibromuscular dysplasia in younger patients, or more often due to atherosclerosis, cholesterol plaque in the older patients. Obstructive sleep apnea related to obesity is also linked, and glandular disorders. Because they are specific conditions, if not identified, the blood pressure control becomes cumbersome and can be difficult, facilitating organ damage. Having been referred to a kidney and hypertension specialist early on can immediately prompt interventions that could reverse or prevent the effect of hypertension left untreated or poorly controlled. Those who should be screened are patients with unusual presentation, such as new onset of hypertension at a especially young age or especially old age. Presentation with very elevated blood pressure. Abrupt onset in patients with previously normal blood pressure control. High blood pressure that does not respond to regular medication regimens, or in those with clinical clues for specific causes. This could be an abdominal bruit, which is a cholesterol plaque found in the abdominal blood vessels, suggestive of renovascular hypertension, or low serum potassium, which is suggestive of primary aldosteronism, is a hormonal disease. Once the cause has been identified, then appropriate therapy can be established.